Okay? And lastly, to finish up figure 1, we have the equipment special sterilization techniques. I would love to coordinate with the technology department, the science and technology department, to do equipment zoom capability. So it zooms into crevices and commonly missed areas during sterilization. The ability to zoom in on a hard-to-reach area. Focus points on increased pathogen accumulation. Recommended instruments for sterilization-specific equipment. So hopefully I can show you a brief picture of the zoom capability. And that actually concludes the H.E.R verified functions or definitions. So this is an example of the zoom feature, and this is highlighting the actual area where you have, for one, contact where the module is not could be connected right here. That's the connector right there. And you have this screw right here that has spiral around. Hair can get caught around there. Substance can get stuck in between the crevices of a screw. If you look at a screw, blood, think about dry blood getting caught in those crevices. And so this entire area right here is would be like crevices and cracks, just mainly because of the screw. Okay? And then here, this is a very delicate area. H.E.R Fusion wants you only to use isopropyl alcohol on that particular portion. And I hand drew this IV pump, so that's just my example of the zoom feature. Of course, these would be computerized drawings. Okay, so that was figure 1A. Now, figure 2. Okay. Figure 2 is a prospective plan that summarizes the department patient equipment usage tracker, an application function in accordance with 12 embodiments used simultaneously to function as one integrated system set to prevent and reduce hospital-acquired infections using H.E.R equipment sterilization guide, H.E.R equipment error guide, department-based sterilization tracker, patient census data, new equipment activity, edit patient equipment, patient inventory and H.E.R verified, discharge, patient history, assigned equipment history, equipment locator, clinical resources, and hospital MSDS. So this is the second screen, and they all have the current date and current time. Okay. Alright. Figure 3 is an emergency room equipment sterilization history function that records and measures precautions, equipment, patient usage, and assigned data. So that's the equipment sterilization history. You can access the EDX. You look at the equipment type, the patient ID and name, last used, and the EDX. Okay? Figure 4, comprises of a function that records and measures risk associated with the transmission of disease. Alerts and precautions consist of several embodiments within a function that perform in lieu of preventive measures through same-name alerts, assignment after discharge date, pathogen alerts, invasive device alerts, room number alerts, alert details functions, duplicate timestamp function, equipment name and ID alert, duplicate patient assignment alert, and a discharge date alert. Those are the different alerts that I believe are pertinent, and then the error guide will pop up. Okay, figure 5 is a departmental bed sterilization tracker that records and tracks patient beds, mattresses, and precautions in accordance with patient improvement alerts, and a mattress replacement request function accompanied by last clean data and device inventory recognition. So here, patient improvement alert, it allows you to see the progress, to know to change out the mattress and IV pumps and things. They can do a mattress replacement if for decubitus ulcers, if there's bleeding that's occurring, open wounds, you know, just as you change your sheets, well, we can change the mattresses too, because, you know, over time, they wear down, and it's just part of the cleanliness process. So, and sterilization process, especially being taken off of isolation, which is where a lot of those specialty mattresses are used in the ICU. You can always access the EDX. Okay, 6 is a function that shows the patient census data analysis tool that provides hospital statistical analysis, data ranges per patient, and departmental organized census data. So here it's broken down by emergency room, intensive care unit, labor and delivery, medical and surgical, operating room, total census, inpatient, and outpatient. So you'll see the statistics. Remember, we're going to correlate the hospital statistics and volumes with the equipment that's available. Okay? Next, figure 7 is a new equipment activity assignment function that recognizes entries by a timestamp tool, assigned personnel, precaution, and PHI protected patient name and ID in accordance with H.E.R Verify embodiment. So, using the H.E.R Verify patient room admission verification process, you'll have the equipment type, room, assignment date, and patient ID and name. So, even if it was some crutches, if it was an IV pump, if it was a mattress, you'll be able to see the type of equipment that patient is on, okay? Next is, and you just click on the patient name, it'll tell you what the equipment type is, what the room number, assignment date, and patient ID is, and everything like that. Figure 8. This says temporary assignment here, is a new equipment activity function that gives rise to a new medical device inventory statistics and patient device monitoring, a combination of several embodiments set forth the function to protect the patients from infection control violations using timestamp, assigned personnel, equipment diagnosis, recommended sterilization chemicals, and equipment type data. Okay, there's also a temporary assignment button for outpatients or high turnover, so that doesn't just get overlooked, or, you know, if they're not going to be admitted, it still gets accounted for. And it's going to have discharge date. RSD stands for recommended sterilization chemical, the EDX equipment diagnosis, the equipment type assigned by a timestamp. So I'm just going to quickly show you what the EDX and a recommended sterilization chemical looks like. This is what the EDX consists of. I'll zoom in as good as I can. Consists of precautions, standard droplet contact, and airborne multi-drug resistance. Consists of symbols, the triangle for standard, the cross, red cross, the droplet yellow, blue cloud, and double arrow is multi-drug resistance. The zone for caution is calculated by using what type of precautions are in place, whether it's droplet contact, airborne, multi-drug resistance. Then the common hospital-acquired infections. I actually designed this chart and integrated this information. The common hospital-acquired infections, so you got coronavirus, influenza type B, scabies, MRSA, VRE, VISA, vancomycin, Enter, Staphylococcus aureus, mycobacteria, tuberculosis. So it tells you for what pathogen on the next level. So it tells you for MRSA, for example, gram-positive, cocci clusters, deep wound. Then it says on the next thing, the RSC, recommended sterilization chemical. Well, there you have HP, okay? Hydrogen peroxide. Okay, so for mycobacteria tuberculosis, you can use isopropyl alcohol, okay? And that falls under zone 1, which is a bloodstream-associated infection. Then you have zone 2, ventilator-associated pneumonia. So you can expect to see meningitis. You can expect to see pertussis, whooping cough. And then you have catheter-related for zone 3, urinary tract infections. You can expect to see Q fever, fungi. You think a catheter, like a fungal infection, you can also expect to see gonorrhea, okay? And it tells you, what type of sterilization to use. Then zone 4, surgical site infections. Well, you have gangrene, you have endometrius, you have rubella, pharyngitis, okay? So, and it tells you, right here, rubella, it comes in contact with the nose and throat, so, and that's through fecal and blood contaminants, rubella virus, toga viridae. You use ETO or 70% ethanol. So that's basically how that works. I put all this information together in 2011, so these charts should be updated before implementation.